The time is 11:33 and you're listening to Sky FM, the People's Radio. It is me, your girl Zoe Peters, and today we're shining a spotlight on women's health and fertility, all right, an area that affects many individuals and families and yet is not openly discussed enough. Okay, today joining us in studio we do have Dr. Joseph, who is a fertility expert. Thank you so much for coming in.
Thank you for having me in Sky FM studios.
We appreciate you. We like to learn on this show.
Yeah, sure.
And a lot of my listeners, are very interested in knowing things, right? So today's topic is IVF, right, and fertility in general. So let's start with the basics of what exactly is IVF.
Thank you very much. Yes, good morning, listeners of Sky FM. Thank you for listening, and thank you for hosting us as Sally International Women's Hospital and Fertility Center.
Yes.
Just as I've been introduced, I'm Dr. Joseph Kafuuma, and I work mainly with women and couples. Yeah,
Yes.
couples trying to have children. But we also do other things. We help pregnant women have children. I mean, we do deliveries,
Yes.
we do antenatals, we do surgeries. So it's not just fertility.
Yes, it's the whole thing.
So
of
we
pregnancy.
do A to Z.
Okay.
A to Z.
Okay.
Basically reproduction and obstetrics, gynecology. It's a whole field.
So basically the female's reproductive system.
Yeah.
Yes, okay. So what exactly is IVF?
So IVF is there are basically three letters. IVF. It refers to in vitro fertilization. So it's a way of it's an assisted reproductive technique which we use to assist couples trying to have children. Maybe to take you just back, infertility.
Yes.
Just to define it, infertility is a disease. Maybe this will help someone. Infertility is not a curse. I'll come back to IVF. Infertility is not a curse. Infertility is not a taboo. It's not that someone did some, magic on you.
It's very common, and I think a lot of people don't know that.
Yeah, it's a disease, and it's a disease according to WHO. It's a disease of the female or male reproductive systems. That's very important. Once people understand that, it will be easier for them to seek medical attention.
Yes.
Yeah. So our bodies are made up of systems. Just like, you can get a cough, that means your respiratory system is being affected or is sick.
Are you trying to say something, Dr.
No, I'm not trying to say anything. But I want people to understand that we get sick.
Yes.
You can get sick. You can fail. One of your systems can fail. People get kidney failures and people go for kidney transplants. People, someone recently, COVID was here affecting the lungs and people couldn't breathe. People would go, be put on oxygen support and all that. So the reproductive system, just like any other system in the body, can also fail in its function. So, and once it fails, people fail or struggle to conceive. So there are different causes, different reasons why the reproductive system can fail. And infertility doesn't only refer to women. Infertility affects women. Infertility affects men because it takes two
to tango.
Exactly. It takes two to get it, to reproduce.
I think that's very important that you've emphasized on the fact that it's also with males.
Yeah.
A lot of us, especially in Africa, there's like a stereotype. As a couple, we aren't having children. The family would look at me. Blame the woman when it's both ways. It could be both of us. Maybe his sperm is, his sperm count is low or whatever it is. It's a two-way street.
I'll share a story.
Yes.
We are coming to IVF, but I'll share a brief story.
Yes.
There is a couple one time I saw. They traveled a long distance, but this couple had been together for a long time.
Yes.
And the family of the man was blaming the lady for not conceiving. All the blame, all the pressure. The man started doing a lot of weird things in front of,
the woman.
Yes. But this lady, one time, they were not going to hospital, and that had happened for a long time.
Yes.
So, because of this too much pressure, she went somewhere and tried to see if maybe the problem was her.
Was her, yes.
Yeah. So she conceived. Because she had taken in a lot, she came and told him, you see me, I can conceive.
Yes.
The problem is not
It's
me, it's
you.
you. Now this is when this guy humbled himself and went and did a test, and yeah, unfortunately his sperm counts were low.
Was low, yes.
Yeah, so that's now when they started to seek for attention and you know, came to us, and now they have a baby boy.
Oh, we thank the Lord.
Yeah, so IVF is in vitro fertilization. In vitro means in a tube, a glass tube or a dish.
Yes.
So because the sperm and the egg, that's the seed of a man and the seed of a woman, which make a baby, have failed to meet in a woman's body. So we find a way of helping them to meet, but outside the body.
Ah, okay.
We are not creating.
Yes.
We are providing conditions for the egg and the sperm to meet from outside the body using this assisted reproductive technique, which is IVF. So in other words, we treat the lady, we give her injections. Injections are comprised of drugs which are hormones which the body produces naturally, but this time we give them externally through injections to stimulate the ovaries to mature many eggs. So once the eggs have matured, we harvest them, we take them out of the body, not through surgery but through a needle.
Oh wow, okay. I actually thought it was like a tube, not a needle. I don't know if a tube is even making sense, but I thought you'd use like a tube.
We use a needle. Yes, we use a tube to bring the egg and the sperm together. That's the test tube. IVF is also known as test tube baby treatment.
Yes.
But the test tube comes in a bit later. We first harvest the eggs using a needle. So once we harvest the eggs, then the husband gives us his sperm sample. We give him a container. We don't take the sperm manually from the man. We give him a sample and he puts a sample. A sample
like the tube thing is
in the tube.
Dish, yes.
So once we receive the eggs and the sperm, in the lab, in the IVF lab, the embryologist or the technician in the lab, you know, they put them together in a test tube and incubate them or culture them in an incubator, just like they do for chicken eggs.
The same process.
Yeah, the same process. Incubator.
Yes.
So we provide conditions for them to fertilize.
Like suitable conditions.
Suitable condition, just as the body would provide. So they fertilize within 24 hours. They fertilize and make babies.
Okay.
Yeah. So we leave them in the incubator to grab it for up to 3 to 5 days.
Okay.
Yeah, so once they formed babies, which we call embryos, then we pick like 2 or 3 and transfer them back into the womb. The process that happens in the incubator is a process that should happen in a woman's fallopian tube. In a woman's fallopian tube, a baby is growing, but a woman is not pregnant yet. So after fertilization in a woman's fallopian tube, not in the womb, a baby starts to grow as it moves into the womb. So that process or that journey takes about 3 to 7 days. Then on the third or, between those days, the baby lands in the womb and starts to implant. That's when a woman becomes pregnant.
Pregnant, yes.
So for us, that process that should happen in a woman's fallopian tube, we do it in the IVF lab. Then we transfer the formed
into her uterus.
Into her uterus.
Okay, that makes so much sense.
Yeah.
So I always knew of the. So I've heard of the whole IVF. I know people who've gone through that. So I kind of knew the procedure. I just didn't know in that capacity.
That detail.
Yes. I just knew they take a woman's eggs, they take a man's sperm, they put them together. I don't know if they mix them and then they put them back.
Maybe to explain it in a simpler form, IVF, the principle of IVF is like you see someone going to plant a bean or a maize seed.
Yes.
So the process a farm undertake, from garden preparation to selecting seeds, plant, weed, harvest is the end. When a baby comes.
Yes.
Yeah, but first thing we do in IVF is to prepare the womb. So we prepare where we shall plant the baby. So that we do a procedure called hysteroscope, where we take a lady, pass a camera down.
Oh, yes.
Then we look inside the womb where the baby grows. So once the womb is okay, then we start the process of making the seed that we'll plant in the womb. So that process takes about 6 to 8 weeks. It's a process, it's a journey. Yeah. So once we are happy with the womb, then we start the preparation of growing eggs. we do a lot of scans, then we harvest the eggs, we use the test tube, we put the eggs and the sperm in a test tube, put them in an incubator. We are not creating, we are assisting.
You're assisting the process.
We are assisting the process. Just as a doctor assists you when you're sick, they treat you and you get better.
No, I think a lot of people often forget that, and I agree with you, that's the thing, that IVF is not about creating life, it's just about assisting.
Assisting,
yes. There are some people who just think, no, they're creating babies in a test tube, and you're not. You still need the humans to give you the egg, or give you the sperm, to help.
Exactly.
Yes.
Exactly.
What are the common causes of infertility in people?
Yes. Just like I said, infertility is a disease of the female or male reproductive system. Yeah, and this is once a couple tries for about 12 months, they've been engaging in regular intercourse.
Yes.
No family planning methods, nothing, but they meet regularly. And then after 12 months, no pregnancy, that's when we advise couples to go and seek help.
Yes.
Yeah, do investigations and all that. So the causes can be due to female causes or male causes,
yes.
or both. There are couples we see whereby a lady has a problem and a man has a problem. Yeah, so it can be a combination of factors.
Of both. That must be something hectic.
Yes. So the causes in male, I'll begin with the males, could be due to the ejection of semen, where a man can't ejaculate.
Yes.
Or a man can't do, can't have intercourse because of maybe issues with erection and all that.
Yes.
Yeah. Issues also, the cause could be due to sperm production, whereby sperm are not being produced.
Like what is it that we just called it, a low sperm count?
It could be no sperm production.
Oh, no sperm at all.
Yeah,
okay.
So the sperm, maybe what men should know is that semen and sperm are different.
I also needed to know that. I think all of us, we didn't know.
Because many men think ejaculating is
sperm. Yes.
No, semen and sperm, the semen is the liquid that a man ejaculates.
Yes.
The sperm and the semen come from different areas along the male reproductive system.
Okay.
So the sperm are produced by the testicles, which are found in the scrotum or the scrotal sac. But the semen is produced, a bulk of it is produced by the prostate gland. I believe many men have heard about a prostate gland.
Yes.
Yeah, because that's a common. Yeah, so they just mix during the process of ejaculation. Yeah?
Okay.
Yeah, so now the problem could be that maybe the factory, which are testicles, are not producing, dysfunctional.
Like not producing at all.
Not produce. The factory is faulty, not working. No. Yeah, so it could be maybe that as a boy during the mother's womb, during pregnancy, there is what we call undescended testicles or testes.
Okay.
Yeah, so once testicles are made within the abdominal cavity, then descend downwards into their final destination, which is the scrotum. Yeah, the scrotum. So that happens during the first 5 months of pregnancy.
Okay.
If a boy during pregnancy, the testes have not, or the testicles have not descended into the scrotum, it might not happen. So once there is no descent of the, once the testicles have not descended, then a man is not going to produce
the semen. The sperm. Yes.
Yeah.
Yes.
So that's an issue with production, but also it could be a testicular failure. Just like any other part of the body can fail.
Yes.
Yeah, so testicles can fail. It could be a hormonal issue because hormones drive the reproductive system.
Yes.
The maturation of sperm, production and all that. So if there is a hormonal imbalance, a man is not going to make sperm, or they are going to produce low quantities.
Yes.
Yeah, so it could be a problem with dilated vessels, what we call varicocele around the testicles. It could be mumps. You've heard about mumps?
Yes, I've heard about mumps. Yes.
Yeah, mumps can affect the parotid.
By your throat?
Around that area.
Yeah.
They affect the parotid glands.
Yes.
Around, yeah. So mumps have, an effect on the sperm production.
Okay.
They affect the testicles.
I think a lot of us didn't know that. Yes.
So it could be production. A lot can affect production. Either no production, low quantities, and all that.
Okay.
Yeah, then it could be a blockage. Because once sperm are produced, they are supposed to be driven out.
Yes.
Yeah, so they go through tubes. You've heard about a vasectomy?
Yes.
So there are tubes called the vas. Once those tubes are cut, so they bring the sperm from the testicles upwards to mix with the semen.
Yes.
So once those tubes are cut, then it's called vasectomy.
Okay.
So that means the sperm are not going to be produced,
yes.
but the man will keep ejaculating. But can be a blockage due to any other reason, not only vasectomy.
Not only a vasectomy, yes.
Then the other issue could be the sperm quality, morphology, the shape of the sperm, the DNA of the sperm. Yes.
Wow.
All those can affect
it, yes.
conception of,
Oh, wow.
So that's on the male side.
Yes, and on the female?
Then on the female side, the problems majorly are due to the fallopian tubes.
Yes.
Yes. So fallopian tubes can be blocked or dysfunctional because fallopian tubes are supposed to bring the egg and the sperm together. So once the fallopian tubes are not able to pick the egg once it's ovulated, then there is not going to be an egg to fertilize. Or the egg might be picked by the tube, but then there is a blockage somewhere
between the sperm and the egg.
Yes, so the sperm is not going to find the egg. It's a blockage. Yeah, so fallopian tubes contribute a big percentage of female causes.
Okay.
Yeah, it could be a problem with ovulation. Many women don't ovulate. And there is a common term these days
Many women?
Yes, don't ovulate.
Oh, wow. Okay.
Yeah, so it's commonly known as hormonal imbalance.
Yes, okay.
Yeah, hormonal imbalance. But hormonal imbalance refers to a group of conditions. It's like an umbrella of conditions, but the commonest is the one we know as polycystic ovarian syndrome, or PCOS. That's a major topic on its own. But PCOS, women with PCOS don't usually ovulate, or they get irregular menstrual cycles. Some have regular, but they are not ovulating. Ovulating is ovulation is a release of an egg.
Yes, yes.
So the eggs don't usually mature. And then once there is no maturation of the egg, there is no ovulation.
Is it, when you say some people don't ovulate, is it a thing of they don't ovulate regularly, like in terms of every month, or they just don't regulate completely?
Now, there are those who do not ovulate completely, but there are those who ovulate irregularly.
Okay.
Yeah, as long as a woman ovulates 8 or less times in a year, those are 8 cycles or less in a year, they are going to struggle to conceive. Yeah, so women with this condition also have other signs or symptoms which they present with. So irregular menstrual cycles, they don't see their periods on a regular basis. That they can take 2 months, 3 months, once in a year, no period in a year, but they may also have other signs on their bodies. There is commonly what we call a male pattern hair distribution. You'll see them with hairs on the chin, on the sideburns, on the chest. A pattern you would see in males.
Are you telling me that also have to do with infertility?
But to note, not every woman who has those hairs. There are those who with hairs, but they conceive. But those with this condition, many of them have that pattern. Because
I was always thinking it was a level of high testosterone in certain women. Yes.
Because testosterone is a male hormone.
Yes.
So it should be in suppressed levels in a female.
Yes.
So once testosterone levels go a bit high, then it's going to affect other female hormones and the egg development and ovulation.
That makes so much sense.
So some gain a lot of weight, with this sort of thing. Others, have acne, pimples.
Yes.
That's a common also occurrence in such women. I usually relate it to a mango tree that puts on so many mangoes.
Yes.
But you don't eat a mango out of it. They all drop when they are small. Have you ever seen such a tree?
Yes, I have. Yes, I have.
I would say that such trees also have hormonal imbalance.
I actually see the metaphor behind it. I can actually see
an ovary is like a mango tree.
I get that. Okay. What services does Sally International Women's Hospital provide for support for such patients?
Of course, we do a range of treatments.
Yes.
Yeah, once a couple is failing to conceive or struggling to conceive, we advise that they come to see a specialist. Of course, when they come, we do investigations, we do scans, we do semen analysis, we do fallopian tube test,
yes,
we do hormonal, analysis. To, we do extensive, investigations.
Okay.
So once we've investigated, then we advise or recommend the
which
one
is suitable.
Yeah, suitable treatment. Much as we are talking about IVF, we do other assisted reproductive technologies. There is what I forgot to tell you is I'm a father of quadruplets. Have
wow.
2 girls, 2 boys. But
wow.
That's not related to what I'm talking about.
Just wow. I'm worried about having one. You have 4 at the same time.
At the same time.
Wow.
Yeah, so there are other assisted reproductive technologies. Yes. Now, like women with hormonal imbalance, if it's just no ovulation, but the fallopian tubes are okay, the man's sperm counts and quality are okay.
Yes.
Yeah, we can trigger ovulation or stimulate the ovaries to mature 1, 2, 3, 4 eggs at the same time, then trigger them to ovulate. Then we tell them when to be together. What we call timely sexual intercourse with ovulation induction.
I think I've actually seen that before when I've heard of people who go through such treatments. They'll say, oh no, my doctor said we should have intercourse at this
particular time during the fertility peak.
Yes, like this. Some of them even have like a calendar, or like apps these days.
Yeah, where they monitor ovulation.
Like,
and all
okay,
that.
now is the time. Now, right now would be better than 2 hours ago.
Yeah, Yeah, but here we monitor. We monitor the lady. We do scans to monitor the egg development.
Yes.
Once they are mature, we give them an injection to make sure they ovulate. Then we tell them when to meet.
Okay.
Yeah, so that way people are able to conceive. Then there is insemination or artificial insemination, what we call IUI, intrauterine insemination. That's very common in animals, whereby they target when the other one is
IUI.
Yeah.
Oh yes, when they target when one is in heat.
Exactly.
And one in,
Then they bring the male semen or sperm and inseminate the female.
Yes.
But here we still prepare the lady. We give her hormonal drugs, tablets or injections to stimulate their ovaries to mature 1, 2, 3, 4 eggs. Then we monitor them on a scan. Then we give an injection to make sure the eggs are released. Just like mangoes ripe on a tree, they are not dropping down. You climb and shake the tree. So we shake the ovary tree.
Yes.
So that the eggs are released. Then we get the sperm of the husband and then prepare it nicely and inseminate. This can also work for men with relatively low sperm counts. Yeah, where the numbers are not too low but moderately low. Insemination can also help them.
Okay.
But it works with normal fallopian tubes. Yeah, so that's the other service.
Yes.
But we do other things related to pregnancies, childbirth, cesarean section, normal deliveries, antenatal. We do cancer, cervical cancer screening. We do surgeries, fibroid surgery, laparoscopy surgeries. Basically, where we don't open the tummy, we just use keyhole. Small incisions.
Yes. So basically everything to do with the female and male reproduction systems.
Yes.
For listeners who may want to learn more and to seek more help, what should they do?
Come visit, come check on us, come have a consultation with a specialist.
Yes.
Yeah, our numbers are on our social media pages, Sal International Women's Hospital and Fertility Center. So you can call, book an appointment with a specialist. Any question you have can be answered via, a call.
Or call, yes, or walk-in.
Yeah, or WhatsApp. You can WhatsApp. Even our numbers are shared.
Okay.
Yeah, so anytime you can get to talk to a specialist.
Okay. Thank you so much, Dr. Joseph. We really do appreciate you for educating me a lot, for educating the masses as well. I always say, you don't know enough as a person, especially stuff like fertility. You know, there are a lot of couples who are going through this, and we spoke about how the stereotypes, one may is just blaming the other, whatever. These are things as a couple and as a woman, even as a man, you know, that's why they say you must go to, the men's hospital, the men's clinic?
Yeah, men's clinic.
Just to get
we also have
everything
a men's
checked
clinic.
up. Oh, at Sally International?
We have
Perfect.
a men's clinic, yeah.
Perfect. So much. Thank you so much for coming, Dr. Joseph Kafuuma. Once again, for our listeners out there, he is from Sally International Women's Hospital, where you are able to call in and to just go online and to look at everything they have to offer, all the services, and you are more than welcome to call in so they can answer all your questions.
Yes.
Thank you so much for joining us once again.
Welcome.
So coming up at 12 o'clock, we do have top of the hour news.